My name is Dr. Avanish Tantry. I'm a consultant pediatrician and I'm currently working in Leeds, and I'm also the clinical lead for the Department of Pediatrics there. So it's difficult to say. I've been a doctor for so long now that I've forgotten what made me get into medicine in the first place. But medicine is complex and challenging, and I like challenges. I think that is what fascinated me when I was studying in college, and I just decided to take the plunge. When I was doing my internship, the pediatric specialty probably challenged me the most. A lot of the time, it does feel like a bit of detective work, as the young children can't really express what is wrong with them. So you have to use your powers of observation to try and work out what is wrong. This is challenging and also stimulating to your brain, and is one of the reasons why I chose this specialty. Also, the other specialties I encountered during my foundation years didn't really interest me as much as pediatrics. So in the end, I decided that this was the right specialty for me. Sort of thing that is probably most rewarding is that the children that have illnesses bounce back quickly from them, and the smiles you get out of them when you make them better is absolutely wonderful. It's probably the best reward you can get, and that is why I love pediatrics. And like I said before, pediatrics is a bit like a puzzle, and you have to sort of use the information you get from parents as well as your own observations to put the pieces together and then come to the right conclusion or the picture. And when it does come together and you get the diagnosis, it is very satisfying. So if I think back to the feedback that I have received over the many years that I've been practicing pediatrics from my patients and parents, things they value most are probably my honesty, my patience, and the fact that I actually listen. They also appreciate the fact that I empower them to make their own decisions. What I value most about them is the trust they place in me to make them and their children better. And that goes a long way in making my job much easier. So I always say that medications are not the answer to everything. So lifestyle also plays an important role in illnesses, and one has to approach this in a very holistic manner. And that's why when I see children and their families, I often go through a lot of part of their lifestyle illnesses before sort of deciding about treatment.